Hello, my name is Colleen Watrous, and I'm going to talk about drawing up and giving shots. And this is Zoe. She's going to be our guinea pig for today. When you give shots, you always want to make sure you have a sterile needle. And as I'm going to take it out of the packet, I'm going to put away my garbage. And this is Banamine. The normal cc of the Banamine that you give is 10 cc. But we're not going to give it to her. I'm just going to show you how to draw it up. To draw it up, you make sure your needle is secure into your syringe. You take off your cap and make sure you pull it away from you so you don't stick yourself. You hold it like that. I'm only going to drop 2 cc's. So I'm going to pull a cc of air into it. I'm going to take my vial, flip it upside down, hold it against my palm. I'm going to insert my needle into the vial, push the air into it, and then drop 2 cc's. And I'll take it out. And there's your needle. And you always want to make sure that you always secure your cap on the syringe. Just like that. When you give shots, you want to make sure to approach your horse and pet them and reassure nothing is wrong. Don't even show them the needle because some horses get nervous. And you want to make sure your cap is securely on your needle so that the needle doesn't fall off. You want to approach them, put your hand on their neck, right here. Where you give the shot, there's a triangle on their neck, right here, indented, because above here, this is all tendon and ligament. And down here is where the spine runs. And right here is the meat muscle in the neck. So you want to give the shot right here. So I'm just going to run my hand down her neck and make sure there's a distance away from the needle. So if they move, the needle is going to go with them. When you give the shot, you're going to take your cap off the needle. Like that. I'm going to flip her around in my hand, and as she moves, that needle is going with her. So then I give the shot, I pinch her neck, just to get her mind off of it, and I just gently ease it in. And then you push the fluid in. And then you just take it out, rub it a little so it's okay, and put your cap back on. And you want to take your needle off, and you always want to dispose of your needle in a sharps container. When you give IV injections, you want to make sure you have the correct amount of medication in your syringe. And you're going to follow the line down their neck. This is when you give your shot. You want to take off your cap to your needle. Place your hand against their neck. Close off the vein. Find where that vein is by just pushing and then letting go. You can see where it is right there. And you're going to slide your needle superficial to the vein, and you're going to pull back, and there's going to be blood. When you want to pull back and mix the blood with the medication, and you want to gently ease it into the vein. And you're going to pull out and cover that vein. You just rub so the blood starts clotting, and you're going to put your cap back on your needle. Now when handling needles and syringes, you want to make sure that they're always sterile. If you touch yourself with the needle, or drop the needle, or touch the horse with the needle, you always want to get a new one. When administering medication, there's 2 points of insertion. One is the nape of the neck, but often causes soreness. So your alternative route is at the point of the button. When you approach your horse, you want to start from the head and work your way back so the horse gets comfortable with you. And you come to the point of the buttocks, which is right here, and you want to insert it halfway down into the gluteus maximus. When you do, you take off your cap, make sure not to touch yourself, flip it around in your hand, just like this, place your palm, the outside of your hand up against the butt. You want to place your arm, so it's just like this with your elbow, so if the horses move, you can move with it. And you want to stay clear of the hind feet so they don't kick you. You just want to rub your hand down and just easily insert the horse, and then push in the medication. And you want to pull out, rub it down, and put your cap on. Good girl. When disposing of your sharps, you want to find the nearest biohazard sharps container. You want to dispose of these in there because they can transmit diseases because of the blood in the needles. And you want to put these in there. Thank you for watching my video. I'm Colleen Watrous, and I'm signing out.